Sidelying Hip Abduction. Okay, we're gonna start off by lying down on our side. You can keep your head supported or you can lie your head down. It doesn't matter, whatever's most comfortable for you. We're gonna start off with our hips bent in this position again, kind of similar to the clamshell. But then we're going to straighten this top leg, okay? We wanna, again, make sure that this leg, if I drew a straight line from my hip all the way down to my ankle, we want that leg in a nice straight line or even slightly back. So again, if we drew a straight line out, that foot can be slightly behind that line as well. We don't want it in front of the line, okay? That's one of the biggest mistakes I see people making with this exercise is that they bring their leg out here and then they do the raise out here. But when you have your hip bent and your foot out in front of your body, we're getting some hip flexor kicking in. We don't want that, okay? We really want to try to isolate our hip abduction muscles right here on the side of our hips. So what we're going to do is keep our leg in a straight line, hips stacked on top of each other or even slightly rolled forward. That's okay too. We don't want our hips rolling backward, okay? So we want to keep our abs braced, hips stacked on top of each other, legs straight out or slightly back, and then we're going to raise the leg and then put it back down. What I want you to feel is really right here in your glute med, your gluteus medius muscle. We're going to feel a nice contraction of that glute med right in here.